Holly's going to do an intradermal injection. Always follow the 6 rights, perform the 3 label checks, and follow standard precautions. Remove the metal cap from the top of the vial. Initial and date the vial. Wipe the rubber diaphragm briskly with an alcohol sponge and let dry. Pull the plunger of the syringe back to aspirate air into the syringe equal to the amount of drug to be withdrawn. Insert the needle into the inverted vial. Inject air and withdraw the volume of solution to be given. Keep the needle under the solution to prevent aspiration of air into the syringe. Plunge the needle gently to disperse the solution to the tip of the needle. Remove air bubbles by gently tapping the syringe. Be sure to provide privacy. Identify your patient. Check for allergies.
I don't have any allergies.
Don gloves. Select a site free from freckles, moles, wounds, vessels on the inner aspect of the lower arm. Insert the needle with a bevel up at approximately a 15-degree angle just under the skin. You'll still be able to see the needle. If there isn't a wheel, the medication is still injected and will be effective. There's no bandage required. Do not recap the needle, just dispose directly into the sharps container. Remove gloves and perform hand hygiene. Instruct the patient to return in 48 to 72 hours. No need to make an appointment, just walk in and check with the nurse. Within an hour, this wheel will go away. And follow your facility protocol to document the injection.
Hi, my name's Shari, and I'm going to give my patient here an insulin injection. This is Holly. Lynn is going to be narrating, and Kelly is filming. So we are going to begin.
Always follow the 6 rights. Perform the 3 label checks. Follow standard precautions. Perform hand hygiene. Check for allergies.
Do you have any known drug allergies?
No.
Okay, no known drug allergies.
Prepare medication according to standard procedure for injectables. Provide privacy.
Okay. Curtain is drawn. We have privacy.
Identify the room, the bed, the patient's birth date. Explain the procedure.
Can you please state your first and last name?
Holly Gold,
Okay, and what's your date of birth?
1477.
Very good. Okay. And I'm going to give you your insulin injection, okay?
Okay.
Do you have a preferred site?
No, wherever.
Okay. How about the back of the arm?
Sounds good.
Okay. On the mannequin is what we're going to use to give this injection.
So you select and expose the site. You check which site was used previously and rotate that site. The abdomen is the usual preferred site when administering insulin, heparin, or Lovenox.
Okay, so we can give the back of the arm on both sides. Obviously, I would check and see which site was used last, and I would rotate the site for that. I would avoid any bruises or bumps or anything in the way. I'm not going to expose her abdomen, but you can give the injection in any of the 4 quadrants 2 inches away from the umbilicus. The lower abdomen is preferred for these injections. But today we're going to inject on this model.
First, clean the site with an alcohol swab from the center
Okay, so I'm
outward.
going to cleanse the site in a circular motion. I'm going to let the alcohol dry so it does not sting going in. Be sure to check with your policies and procedures at where you're working, because some locations do not alcohol for insulin injections. So it's always good to check. You are going to get 4 units of regular insulin. Always have a second nurse verify for your insulin. We have 4 units of regular insulin. Okay, my medication is ready.
Now don your gloves. Slightly pinch the selected site and hold firmly. Insert the needle at a 45-degree angle with the bevel up. Apply an antiseptic swab or a 2x2 gauze sponge. Do not recap the needle. If a safety glide needle is used, advanced protective glide, dispose directly into the sharps container. Remove gloves and perform hand hygiene. Document the site used and amount and type of medication. Subcutaneous. Record your initials, the date, and time.
Hi, my name is Monica. I'm a nursing student at BTC. Today I'll be demonstrating an IM injection on a 31-year-old female. The first thing we'll want to do is pick out our needle gauge and size. Okay, so we know that she is over 19 years old, so we're going to give it in the deltoid muscle, and it can be 1 to 1.5 length and 22 to 25 gauge. What we have on hand is 25 gauge 1 inch, which is fine because it's in the deltoid, so we don't want it to be too long. So whenever you first open a multi-use vial, you always want to initial and date and keep that on the vial. I prefer to wear gloves in case I touch the plunger. You always want to alcohol the vial, especially with the multi-use vial. We're going to inject a 0.5 ml of air, so we're going to draw up some air so that we can put that into the vial. And then we're going to inject that into the vial and draw up half. It's okay to overdraw at first, that way you can get all of the air out. It's best to do it as fast as possible so that you prevent air bubbles. And then you can tap it as well to get any extra air bubbles out. And then you're going to recap. If I was going to use several injections, I would label each of them with what medication I was injecting. That way I avoid mixing up and I know exactly where and what I am injecting. It's also important to make a note of the lot number and expiration date so that after you're done you can chart that. Then you're going to compare the vaccine to the MAR before you put it away, and that's your third label check, and then you're ready to put it away. You always want to make sure that you use the 6 rights of medication administration, which are right patient, right drug, right dose, right route, right time, and right documentation. Can I have you state your name and date of birth, please?
Jacqueline Kirsten, 10/8/79.
Okay. Do you have any allergies I should know about? Are you allergic to eggs?
No.
Okay. So. You're going to want to find the acromion process, and then you're going to want to go 3 finger widths down, which is right there. And then you're going to want to alcohol press that part. You always want to go bevel up. And you're going to anchor the muscle and inject at a 90-degree angle. Make sure the safety's on. Put it in the sharp. Put pressure on it. And then you're going to document. And we have the lot number and expiration date from before, so we're just going to type that into the computer. And then it's always good to give an information sheet with whatever vaccine you're getting. So this is the influenza vaccine information sheet.